Medication administration, IV piggyback, secondary. Med check 1. Check accuracy and completeness of MAR versus prescriber's order and pull medication. Perform the 6 rights of medication administration per ATI for each of the 3 med checks: right patient, right medication, right dose, right time and frequency, right route, right documentation. Additional rights include right patient education, right to refuse, right assessment, right evaluation. Med check 2. Prepare medication and compare medication label to MAR. Perform the 6 rights of medication administration. Be sure to check expiration date on all medications. Safety checks, NPSG. Enter the patient's room and provide patient privacy. Introduce yourself. Wash hands per CDC guidelines. Identify the patient correctly using 2 identifiers. Verify allergy status. Assess the patient's condition. Assess for any contraindications, such as difficulty swallowing or decreased level of consciousness. Assess the IV site for any phlebitis or infiltration. Look for the presence of pain, redness, or swelling. Check any appropriate laboratory results based on the medication that the physician ordered. Do not leave drugs unattended. Label medications if applicable. Educate the patient. Explain the purpose of any ordered medication. Inform the patient of any possible side effects, and ask if the patient has any questions. Verify the patient using 2 identifiers and check allergy status to MAR. Med check 3. Check medication to the MAR at the patient's bedside. Perform the 6 rights of medication administration. Close the roller clamp on the secondary tubing and spike the secondary infusion. Clean the Y-site port on the primary tubing with an antiseptic pad. Connect the secondary line to the Y-site port. Lower the secondary infusion below the primary infusion. Open the roller clamp on the secondary tubing and allow the fluid to back prime from the primary infusion to the secondary infusion. Close the roller clamp once the secondary tubing is primed. Hang the secondary infusion to the IV pole. Ensure the primary infusion bag is below the secondary, aka the piggyback. Program the IV pump based on the physician's order. Open the secondary infusion's clamp and press Start. Ensure the secondary infusion is infusing by observing the drip chamber. Dispose of soiled supplies. Ensure a safe environment, returning bed to appropriate height with brakes locked, appropriate side rails up, and call light within reach. Wash hands per CDC guidelines.